First of all, welcome everybody. This morning for our mastermind call, I was talking with, I've had a lot of conversations lately, and let me just kind of explain this to you because a common theme that all you guys are having, and there's a lot of people that are not on this call that are having as well, is frustration. And the frustration has a transcendent foundational effect that people that come into the office just don't get it. And that's a common thing across chiropractic is that we get frustrated internally. Our staff gets frustrated because people start missing their appointments. They won't sign on to care plans. They don't accept your recommendations. They don't do their home care. They don't come in for the proper number of adjustments. They quit before their correction is made, or if they start feeling better, they quit. Or sometimes if they don't start feeling better, they quit. And it's frustrating. So one of the things that I often talk about, especially on one-on-one coaching calls, is we really need to practice and work on and role play our communication, not just personally as doctors, but with our team as well. And so it's so vital that we know we own the principle of chiropractic and how to communicate that very effectively. So it's inspiring, so people welcome it, so they don't question it. And one of the things that we've talked about lately is asking a lot of questions and directing the conversation with proper questions. So one of the things that we all do, obviously, is we want to make sure people understand the nervous system is key and removing interference from the nervous system is key. And so this is why in our conversations, Dr. Kory has offered, and of course, I suggested to Dr. Kory to come on and actually do a call, and he's more than willing to do that. So I really give him a lot of credit because one thing, and I've known Kory for a long time, he has worked on incredibly improving his skills on how to communicate spinal correction and why it's so important. Not to mention mastering his delivery of the adjustment and his delivery of a spinal corrective care process in his clinic. And now, obviously, that he's moved to a different clinic, he's starting fresh, but knowing what he knows already and using those same principles, I'm very confident that he's going to just crush it in his new location and he's going to grow this clinic as fast or faster than the other clinic has grown to be extremely successful. So, without further ado, I want to turn it over this morning to Dr. Kory. He's got some stuff prepared for everybody, and then we're going to open it up for questions after the fact. Dr. Kory, welcome.
Thank you for having me. And so when we were talking, the big thing comes from the confidence of what you're delivering. And so when you're looking at spinal correction, for me, it was actually getting my own spine corrected and seeing that process happen. And so I was willing to do anything to get better. I'd been adjusted a long time and a lot of adjustments, and my spinal curves were really detrimental to my health. I was having numbness and tingling in my face, in my back, into parts I don't even want to talk about. And I remember laying on Dr. Tony's table and just saying, I don't know what I'm going to do. And I was almost in tears, like I was. And he's like, hey man, we're just going to fix it. And like something hit me. It was just like, oh, we're just gonna fix what's happening. We're gonna take some x-rays and put you through everything that we know how to do. And then that confidence kind of just shifted to me as a patient. I was like, this is not a difficult concept, is we're just gonna fix what's happening. And so the number one thing is that your communication, sometimes straight and to the point and very direct is the best. You don't have to sugarcoat a lot of the stuff that I believe that we try to sugarcoat. And the major thing that I've changed in our new clinic is that we have to say subluxation at least 30 times on their new appointment, at least 30 times. And so a large portion of that falls on the doctor in the exam room. At least 20 times happen in the exam room. And so when you're talking about chiropractic, the mindset behind subluxation, how detrimental it is, and how confident you're in that concept, that will translate to your patients. And we're currently only open 3 days a week. It's Tuesday, Wednesday, and Thursday from 2:30 to 5:30. So the only time that people can come is those three adjustments. And so we've restricted our hours down to condense because there's not enough current patients. So I'm not going to be having 15 shifts. We have 3 shifts. And so it's very stressful on the patient. But I say, we need to see within 24 to 48 hours. That's just what your spine is telling us. And I know that you know a lot of the people on the calls know this, but it's the mindset behind what you're delivering. And so when you do a day one x-ray, when you do a day two x-ray, it's very important to have those skills with a server guard or with a body weight or a head weight. And then it's distinguishing yourself from the guy down the street. The hardest thing to probably pull off is to deliver the same care as the gentleman down the street or the gal down the street and tell the patient that you're a corrective office. the same adjustments, the same care, the same recommendations, the same costs. And so when you really look at how successful or and I didn't realize people were so frustrated. So when you look at the frustration, and I always tell myself this, and it's very difficult, I'm usually making it about me when I'm frustrated. I'm usually making it about that I didn't do something correct to get them to sign a care plan to move where I wanted them to move. So asking questions is very crucial in knowing what your patient wants. And so on the first visit, I always ask, are we looking to fix this? Are we looking just to kind of cover it up? Are we looking just to feel good? And you have to let them answer. I talk less now in practice than I ever have. I don't interrupt. I don't say okay. I just kind of say, mm-hmm. And sometimes just letting them talk themselves into or out of it is the best way to be. And so a prime example is I had a gentleman just recently, Matt, who talked himself in circles for literally 22 minutes, and I sat there and said nothing. And he finally looked up at me and said, "What do you think I should do?" And I said, "I think you should fix it." And that's all I said. He said, "Okay." So, but how many chiropractors would have interrupted, interjected, tried to convince? When you know you're right, when you know the care is going to work, you don't have to say much. Like the tough guy that shows up to the bar, he doesn't have to say much. You know he's the tough guy. Like and I'm not saying you have to be tough on your patients, but you just have to know what you do and what you deliver works really well. And we had this common theme in our other practice in Winnipeg. Where else are they going to go? So when you talk about when they come in and they have a tour and they see your wobbles and tractions and they see you're adjusting different and you have these vibe plates and people doing these things, that initial shock factor with the tour and your team communicating properly should be enough for them to want to be there. And so as we walk through this, I think communication, like Dr. Collin was saying, is the number one thing. Saying less sometimes is more. And so I don't really talk that much. We rely strictly on our results and our adjustments and the rehab, and we let the x-rays that we take do the talking. Here are your initial x-rays, here are the second set. Do you want to correct this? If they don't want to correct it, what does care look like for you? And I have a script written out for my day two, day three, the day three when we talk about care, and I always say it in this fashion. Now, I know that everyone wants help, and what the help looks like is always different. Have you had some time to consider what you'd like to do? I want to fix it. Great. I think fixing it as fast as possible would be the best option, don't you? Yes. What that looks like for you is 3 times a week for 6 weeks, twice a week for 6 weeks, once a week for 12 for 14. Over 6 months, it's 30 appointments, it's $5,900. These are the options you have. Do you want 5%, 8%, or 10% off? That's literally my script for signing up care plans. It's not a lot. Once they decide if they want 5, 8, or 10%, we took away the large, atrocious discounts in our clinic, max 10% off. And more people sign care plans now more than ever, including the clinic in Winnipeg, without me even being there. Them using all the same systems, using my report of findings online, they're still signing care plans with a different doctor in the office, just using the systems that Dr. Cullen and Dr. Bryan have taught us. It's not a difficult concept. It's just saying less is more. So that's the number one thing I wanted to talk about. Um, Now, the principle of chiropractic is extremely important, obviously, in spinal correction. We are in our office currently very mechanistic because of the fact that our team is not trained yet in the principle of chiropractic. And so we are constantly pouring that into our team, but we're also working on procedures and implementing new stuff all the time. And so I wanted to open up some questions about spinal correction. That's how this all got started, was based on the spinal corrective model. Does anyone have any questions about anything to do with server guards, body weights, and bracing? I did post some x-rays in the group, but we have multiple x-rays like that. I wanted to give just a little bit of time for someone to ask any questions. I know Phil was very adamant about, I had a conversation with him about the spinal corrective process. Is everybody doing server guards, day two x-rays, vibe plate, body weighting, that kind of stuff? Most people are doing that. Dr. Collin, would you know that or no?
So I'm going to say no.
Okay.
A lot of the people on this line right now are not doing that type of
Okay.
process, Kory.
Okay, so that's where I got my confidence from, and I'm not telling anyone that they have to do it that way. You can certainly do it without doing a day two stress film and stress X-ray. It depends on your level of communication. For me, my mindset was the worst thing for me was to adjust these people the 12 times, take a re-X-ray, and the curves are worse. Like I hate that because of the concept and principle of chiropractic. I'm like, it should be better, right? And I do take a lot of that responsibility on myself because even if they're not doing their home care, there should be some change. And I had that happen because I couldn't get home care kits for the last month. I've had 3 patients go through 3 times a week for the 4 weeks, we took x-rays and they're all improving in structure. So 4 or 5 degrees, which is really good. But in my brain, I'm like, well, if we had home care kits, it would have been 10 to 12 to 15 degrees. And so that for me, that was my mindset. I needed to see it on an x-ray so I could just tell the patients they were getting better. And you don't have to, if you don't have to see it and you're just like, if they're getting adjusted, they're always getting better. If they're laying on our tables, they're always getting better. That's the concept. But we have to figure out what works best for you. And for our clinic, I never was looking to increase revenue, but the revenue, because we focused on chiropractic therapy and on rehab, it doubled in 3 years. And so we went from a $500,000 clinic to over $1 million clinic, seeing about 250, 243. I think was the accurate stat in a week. So when you put your time and energy into this, it not only helps the patients get better, but it also increases your profitability in your clinic so that you can, most people, most of the chiropractors that I've been talking to feel very valuable when they make more money or are very successful. And so what we really want to do is have a conversation about how do we implement some of these things, but not rely on these things because the communication is the number one part. The principle of chiropractic is the number one part. And I was very hesitant for a long time to put vibe therapy in my office, to do head weighting. It was kind of like something that the people did in the back sometimes. And I know some clinics function that way, and that's okay. But for us, if you want the structural long-term correction, you have to participate 100% in our practice. That's what we tell people. If you're looking to fix this long term, you need to be here and you need to be here often. And your appointments are not 10 minutes, they're 45 minutes in our office between the warm ups, the adjustment, and the vibe therapy, bracing, and body weighting. On an exam day, it's an hour and a half. So the value of time, if people value time, they're going to spend a lot of time in our office. They're going to be there a long time. They're not going to be there a long time with the doctor. We tell them their appointments are 45 minutes. And so selling a care plan, because we're always selling something, if you have a time constraint in your mind, or if you have a value constraint around chiropractic, the best thing I can tell you to do is visit Tony's office and see how and what they do in terms of spinal correction. And then you can have a better idea. And if you're willing to pay for it yourself, I firmly believe that your patients will always be willing to pay for it. And so the big mindset shift for me was always we're not getting the correction. I'm adjusting these people, adjusting them lots, and we're not getting the change that we want. And so it was always that dreaded conversation of, oh, well, it's worse, and this is what we expected. And I knew in my heart, that's not what I expect. That's not ever what you expect. You expect people getting adjusted and doing rehab and home care for them to get better. Symptoms, functionality, bend, twisting, moving, digestion, respiration, and you expect some spinal change. And that's what we promote in our office. If we do everything properly, we get pain relief, we get function improvement, bending, twisting, moving, digestion, sleeping, respiration, and we get some structural change on your x-rays. Those are the three benchmarks we look for in our office. Most other chiropractors are looking to get you out of pain and then they'll tell you it's corrected. And I'm grateful that you've been in another office for such a long time because your spinal x-rays will look way worse. But what we really need to do is make some everlasting impact in your nervous system. And once we do that with the adjustments and the rehab and the stuff we do in our office, you're going to be extremely happy and want to talk to everybody. Does anyone have any questions yet about anything we have talked about?
What I would love you to do, Kory, and this is really interesting because I know there's obviously with all the different docs in our group, not everybody does the exact same entry procedure that,
Hmm.
that essentially that we teach or that you do. Everybody has their own modification of that. Some do group
Hmm.
doctor support, some do report of findings, some do the video.
Hmm.
And I think you just mentioned you do an online report of findings or online report before you
Hmm.
go over the care plan. Is that correct?
Absolutely.
I would love you to just kind of go over what specific key points you bring up in the day one or day two that you know are absolutely necessary for the person to get before you present a care plan so that your odds of converting that patient onto a care plan are very high.
So the number one thing I'm looking for is why they're in our office. Because if they're there simply to make their back pain go away or to get a Y strap adjustment, that's our focus. We meet them where they're at. We truly do. Um, Currently, our office is not in a lavish community, if you could imagine. It's more so in a more poverty-stricken community. So what we do a lot of is asking patients, why? What made you click on our ad? What made you come in today? That's a very important question. Neck pain, back pain, headaches. Is it only the pain, or is it correcting this long term. Everybody's going to say correcting it long term. Great. Once you have them saying that and you have transitioned that communication to correcting this long term, that's what this typically looks like. Today, what we're going to do. So I want to know what they're there for, and I want to know what's driving them in our office. Do they want correction? Are they just saying it's pain, but they want correction? Because people don't typically tell you exactly what they want to do. They tell you usually as a doctor, because even more so down here, what I notice is you're a doctor. I'm going to tell you what I think you think I want. And so I just give them the ability to speak freely. Can I be candid? Please tell me so I know how to serve you best. Like we want to know the hot button. We want to know why they're there. We don't know what made them come now. It's getting bad. I can't stand it. It sounds like you're ready to correct this. Am I am I right in saying that? Absolutely. It sounds like you're ready to not use chiropractic haphazardly. You're more ready to use it structured. Is that correct? Those are the types of questions I ask the patient. It's very driven towards getting them to move, obviously, where I want them to move, because we want them to understand and almost get out of their own way. Because typically the patients are worried about cost and frequency. How many times they're going to have to come here and how much is it going to cost me? So we got to get their mind out of fight, flight around money and time. And so that's what we address. The last time when you were in a chiropractic office, were you on some sort of structured care recommendation? Did you follow through? Or would you say you use chiropractic more on a haphazard basis? Like when it's a crisis, you go a couple times and it feels better. Those are the types of really in-depth conversations I'm having with patients currently in our office.
I think this is brilliant, Kory, and this really is turning into a sales masterclass, which is really, and I want to make sure we identify this and boil this down, which is your incredible ability to help the patient make the decision they need to make for their own purposes in the long term. So would you say that your process over day one, day two, and even day three, would it be more teaching the patient or would it be more asking the right questions?
It'd be more asking the right questions currently. We do have a huge teaching component, but I leave that to my team. We leave that to the office tour. We leave that to the subluxation pamphlet. We leave that to that when we listen to what they're looking for. And then I ask these questions, but then I go into the ML script of this is what I think we're dealing with. It's not a simple muscle or ligament issue, it's subluxation. What I mean by that is the bone is shifted. Like we script that all, so that's all teaching. But I spend more time right now asking questions to the patient.
Are there certain things that you anchor them to before you present them with a care plan that's $5,900? Are there certain things that you anchor them to help them to raise their own mental bar of what the investment's going to be into their health?
Absolutely. I ask three distinct questions for them when I'm looking at care plan. When we spoke on your first appointment, you mentioned to me that you're ready to correct this. Is that still the case? Yes. And if we do not correct this in the next 1, 3, 5, 6 months, would you say it's going to get better for you or get worse? It's going to get worse. It sounds like to me you're fed up with these symptoms, but also disappointed in what your x-rays currently look like and how it's impacting your nervous system. Is that correct? Yes. Are you ready to fix it? Those are the strategic questions I ask them.
That's brilliant. I
And
hope
then
everybody,
go ahead.
sorry, I don't mean to interrupt you. I hope everybody
Yep.
wrote that down. That is absolute gold right there.
And then we look at a care plan. I want to make a very accurate distinction. Our care plan and our financial plan are different. The care is just the care. What the care is structured like. It's 3 times a week for this many weeks. And I tell them before I even turn the page to them for them to look at it, at a minimum, it's 3 times a week for 6 weeks to get you where you want to be. Minimum. And I let them say something. Whatever it is, I'm sitting there waiting. Wow, that's a lot. Well, that sounds okay. And you say, absolutely. And you smile. This is what I do. Yeah, absolutely. Are you prepared to do that? Yep. Perfect. And so then I flip the page over. I look at the 3 times a week, examine x-rays, twice a week, examine x-rays, 1 time a week, examine x-rays. After the 6 months, we will sit down and figure out what it looks like moving forward. Pre-frame wellness care before they even question it. After the 6 months, we are going to sit down and figure out what wellness care looks like for you. Please remember, it takes 1 to 2 years to fully correct a spine. This is just the initial investment into your health. I say investment when I'm looking at the care schedule, not the money. I hope everyone can understand that. And so they know they're investing in themselves. Wait for them to respond. Do you want to pay every time you come in and pay full fee for care? Or are you interested in looking at a discount? Everybody down here says, of course I want a discount. Everyone up there is going to say, of course I want a discount. This is what that looks like for you. You put $1,500 down on your care, you get 10% off. All your adjustments go from 65 to 58.50. All your vibe therapy goes from 25 to 22.50. Your exams and x-rays go from 1,050 to 950. Your home care kit goes from 475 to 4 whatever 27.50. The total is $5,900. You put $1,500 down, your payments are 651 monthly for 6 months. Is this what you would like to do?
Okay,
I
so
always I always
take a
show
pause.
them, sorry, go ahead. I
Take
always
a
show them the
pause.
largest discount. Sorry.
Yeah, take a pause here and I want you guys to digest this. So care plan, you're talking $651 for an individual person per month for 6 months. All right.
Plus a $1,500 deposit.
Plus $1,500 deposit. Okay, so everybody, so let that sink in, raise your bar. Many of you are having a hard time charging $65 per visit. Okay, so raise your bar here on this. But it comes from the expertise and asking the right questions to get them in that mindset that this is important enough to get corrected long term. So let me just ask you now, Kory. So how do you address the person you've gone through this, everything's gone well, they've answered all the questions the way that you would hope and expect them to answer, and then they
Mhm.
say, no, I just would rather just pay as I go.
Absolutely, Colin. I completely understand that. Typically, most people, if I could be candid, that choose that option are not committed to correcting the spine. I've never had somebody in 15 years go through this and pay every visit and get the results they're looking for.
Great response. So, okay, so I'd still like to just pay as I go.
Yeah, that's completely okay. Do you have any questions for
Good.
me?
You've set the bar. That's
Do you, no,
fantastic.
no, do you have, because I have another piece. Do you have any questions for me? Because maybe I didn't explain something properly enough because typically we don't have people go through correction and want to pay me more.
Yeah, this is good.
That's exactly what I say because typically they don't. Why are they paying you more if they're worried about money? Why would they pay per visit? Because they're quitting. So just address it. Just ask them.
So again, let's digest that a little bit and say, okay, so for those of you who are having a hard time getting people signed up on a care plan, does the pay-as-you-go option exceed the amount that they're going to pay when they go onto the care plan? In other words, is there an obvious discounted reason or rationale to say, yes, it's more advantageous to me to be on a care plan than to pay as I go? So if that is not the case in your office, restructure things so that it's an obvious extra expense to pay every visit without being on a care plan.
Yeah, it's $90 here. It's 65 for an adjustment, 25 for that therapy. So it's $90 US. So it's 125 an adjustment Canadian. That's what we're currently charging. And we're not in a wealthy area. I'm just want to make this very clear. The only mindset difference, I believe, is that people come into the office now expecting to pay, but they also come into your office expecting to pay. They know that OHIP, they know that mental health, they know that none of that pays for this. I think that just our own structured brain that we're like, oh, they think they're getting right. And so we talk a lot about that or insurance questions. So here it's a little bit different and more tricky. Um, they're coming to our office and they can't use their insurance. So they can't use any insurance with us because we're an out-of-network provider. What that means is they have to pay a large sum of money and forfeit their insurance to be in our office.
Kory, great stuff. I love it. I love the confidence. I have a question for the when you were back in Canada and for us
Mhm.
in Ontario, I'm
Mhm.
getting about 1 out of 10 insurance companies who want the debit or like Visa slip, not
Mhm.
statement per visit, or they're not getting reimbursed. Has anyone
Mhm.
figured out how to manufacture little Visa slips? So even if they prepaid, they're not actually like unhappy with the statement. The patient wants it, but their insurance company wants that little slip. So they may know how to get out of that.
The little debit receipt that they
Yeah,
made the payment, they
yeah,
won't
on
take.
that per visit.
I've never heard of that before. I'm sorry. I don't know. I've never heard of that.
Now, so they even prepay. they did everything, and then they come back after $500 and say, I can't get any money back because I don't have a slip.
Mm.
And
I
even
would.
like people who've been with me 15, 20 years now are coming back saying, this is the new way my insurance is running. So it's been a kind of maybe in the last year and a half. So that
So,
we're trying to figure out how to get out of it. We do make manual statements, and then they actually want a signature, some of the companies, and for them to access, like, and you're still talking only $500. So it's interesting how you say like they don't use any of their insurance, and so what? Because
mm.
the best. So thank you for that, just that mindset. But
Just,
if
just,
Mhm.
we'll
yeah,
deal with that.
Justine, I haven't had that happen in my office yet at all. I only get that if orthotics are made. So we have to provide a slip, but we've never had a single patient ask us for individual slips. We never even had to submit slips for full plans either. So we've never seen that, and I'm not that far from the right.
I
Yeah,
have an answer. I have an
Yeah.
answer for that though. I just thought of it. This is what I would currently do.
yeah,
My day one, I would do a day one at $100. I would do a day two at 190, and I'd print the slips. Day three would be $100. I would sign the care plan, get everything functional, but give them 5 slips tallying $100. Easy. Run it. Here's your $100. Run it, and then take their information. This payment is separate from the slips to get you your insurance back. Let's run that $1,500, but for day 1 through 5, I charge them $100, $100, $100, $100. Submit to your insurance, be done with it, and say, hey, they're going to refund back whatever they refund back. Your monthly payments are $600, your investment. Let's take that 500 off the care plan, correct? You
yeah.
know what I mean? I would run 5 individual slips on 5 different days so they could never come at you. I would consider that part of the prepayment, and I'd run $1,000 to make 1,500, and then I put them on monthly. That's what I would do.
Great idea, Kory. I hope it's just me. Thank you. That's a great idea because it's not even your new patients. It's the ones who've been with you for ages, have been paying monthly, and all of a sudden they're getting screwed, not getting their insurance money
Yeah.
back.
I would say the new care plans are so you get your insurance back. We figured it out. You're going to pay 5 $100 payments in your first
Yep.
5 visits, and your monthly payments are going to be now from 322 to
Yep.
297. That's why there's a difference because you're paying per visit for your first 5. We will run the slips for you and have them ready for you. You
Cool.
know what I've really adapted is I just figure stuff out real quick.
Yeah.
Um,
No, it's a good
you
idea.
know what I mean? Like, it's not just me. I'm like, how can I make this work? Just play the game better than they do. That's my mindset. Play the
Love
game better than that insurance company. They're trying to screw with your patients, excuse my language. And so just figure it out real quick.
it. Excellent. Thank you.
You're welcome.
Good advice, Kory.
Hey, Corey, for people just getting into the corrective piece, so we know there's a few of us that have been doing it for a while. Others, like Phil was asking, like trying to get into it.
Hmm.
What would you say is the biggest transition piece to help patients understand the benefit, like I guess the premier care
Hmm.
versus quote unquote regular care,
Hmm.
whether that be what sets our office apart or even for, because everyone here has got standard practice, right? They've had a long-standing practice, encouraging existing members to start to experience a higher level.
Hmm. I've had this because we're doing it right now. It's we can continue doing the same thing and you're going to get great results in our office. However, I think and I believe that you deserve way more. And the things that we're doing are that way more. And so I'd love for you just to have an adjustment on us. This is what I would do. Do the whole shebang, the biped bracing and body weighting. And what I'd like to do is just take a set of x-rays. And I'm going to do that on me. You've been a patient for 15 years. You're committed to care. But I just want you to see the difference of how you feel, how your body functions. And I'm going to show you the x-rays next time of how much more correction we can get if we do these new things. Does that sound good to you?
That's great. Very good. So
So
I
that's
just want
what
to,
we're, go ahead.
yeah, thank you, Kory. This is brilliant. I just want to bring up because I know there's a few people in our group who don't take X-rays. Either they don't have access to X-rays in our office and they send out for them, so they don't necessarily
Hmm.
take them perhaps 100% of the time. Or
Hmm.
there's other people in our group who just do not take X-rays and they use neurological scans. So, can I ask you, how would you relay your communication to those docs who maybe don't necessarily have an X-ray dependent process, but you want to still give the patient the idea and the incentive to make that neurological correction? So, I'm just curious how you would modify those perhaps questions or direction to the patient.
So I'd focus on function. I would literally I would do this exact same procedures. I wouldn't change one thing, but my heavy weight would be on the function of your body. And so if you have a neuro scan, a CLA, if you have what's the other one? The very popular, the myovision. If
Myovision.
you
Yeah.
had that on day two, what I would do is I would say, I'm going to adjust you today. We're going to do some therapy, rehab, vibe plate therapy, bracing, and body weighting. We myovisioned you on your first visit. I'm going to immediately myovision scan you after, and we're going to compare them. And we're going to see how functionally your body's adapting. Because one thing we know is when you're in the brace and body weight, your spine has to change. There's no question that the structure or shape is changing. I can see it posturally. And what I would do is I would take a picture of them on an iPad with standing in good posture. And then I would take a picture of them in the brace, in the body weight after the vibe therapy. So you can go over those two pictures and go over their myovision scans or their CLA scans on day three and say, this is how much better your body is functioning. This is what your posture looks like. I'm expecting it's going to take 38 visits over the next 6 months to get this fully corrected.
That's excellent. Excellent. And I just want to bring up the point too, because we use this scan very, very regularly for this, is that let's say you do a pre and post scan on a patient after intervention, whether it's an adjustment or Cerviguard or any type of vibe plate or anything. Any change is good. So it doesn't have to be better. Just because the
Mhm.
scan is worse doesn't mean it's a bad thing. In fact, that probably means it's a good thing because their body has to change and break down. Just like you would go and work out, you break down a muscle before it grows. Same thing neurologically. You break down spinal alignment before it adapts and changes neurologically. So these are excellent things to understand and relate to the patient.
And think about this. You're doing a pre and post scan of an adjustment and a rehab. Nobody is that confident to do that. No other doctor is doing that. You do it and get really good at this. You can say, hey, our process today is get you adjusted to $65. Vibe therapy is 25, a new scan is 100. It's $190 today. How would you like to take care of that? Do you want to do that and figure that out for you so we can figure out the long-term results for you and how to give you some care? What I mean by that is this is going to tell me if we start 3 times a week, twice a week, or once a week. This is going to give me a good idea of how I give you some options on fixing this. I'll always give you three different options, fixing it really fast, which is the best, medium, or slow pace. But ultimately, it comes down to what you want to do in our office.
Excellent.
Your day two just went to $190 from $60 or $50. So every day two now is coming off Facebook is paying 49, and then they're paying 190. That's what I would do.
And hey, listen, and I want you guys to think about this. And for those, and I know there's some docs not on this line who use this procedure, who still stand firmly about providing care on the first visit. Okay. And I know, strangely enough, that's still very popular in our profession, and people graduate thinking that they have to provide care on the first visit to quote unquote help the person. So, but here's the thing. Let's say your day one included that. You're doing an examination, you do a scan, and then you do go ahead and provide care, but then have the ability to do a rescan afterwards and show the person the difference. Maybe your day two now becomes the report of findings of the difference of those two scans before and after the adjustment or the vibe plate or the home care that they would do inside the office on day one, whatever you choose to do. And then you have some leverage and some justification for providing chiropractic care and a long-term plan for that patient. It's so simple when you put it into this. So this is excellent, excellent conversation.
And I make a suggestion for those patients, for those docs that are doing that. Give it an hour. Hey, I want to review all the findings. I want to look at the scans. I want to look at my exam sheet. I want to think about what I'm going to prescribe for you. I can adjust you today. It can't happen immediately. I need an hour. Can you come back in an hour? Or would you like to schedule for tomorrow? Give them an option. Nobody's going to buck. Even if you don't think about their care, you do not look at their file, you do not look at the scans, give it some time. You know, when someone insults you, you're supposed to just sit there and wait, just to wait, and then ask them to repeat it again to you. Just let your patient just feel that, hey, this guy's actually going to think about what he's going to do with me. Because here's what I know as a patient, what I would think, and what most people would think. If you adjust them immediately, what did I pay for? Give me some time to think about what I'm going to do. I'm going to review your file. I'm going to look at the scans. I'm going to look at the posture pictures. Just give me some time to think through it about how I'm going to adjust you.
This is so good. This is really, really, this is such a great call.
That's what I would do. And then they come back in an hour, say, you're going to adjust them. I'm going to do some vibe therapy. I have some time to think about it, do some rehab. I want to rescan you actually to see the changes we get. That's really going to predict how I give you some recommendations. I'm not going to haphazardly just tell you to come 3 times a week like the guy down the street. I'm going to figure it out for you. That's what I would say.
So Kory, tell me, or tell the group, if you will, or share with the group, what would be the first month leading up to the first re-exam? What are your expectations? What's the conversation? Are you pre-framing what happens during that first re-exam, and then explain what happens during the first re-exam and then afterwards?
Okay, so at the about eighth visit, I say we have about 2 weeks left. I always pre-frame by asking, are you doing your home care? Amazing. Then we can expect some amazing shift and changes on your spine and x-rays. I'm excited for 2 weeks from now where we get to look at the x-rays. We're going to take some new images. We're going to do some new scans, flexibility. We're going to do all those things over again. What is the, Colin, what's the number one thing you've noticed in the last 2 or 3 weeks of care under our office?
My bowels are regular.
Nice, and that would affect absolutely everything when you think about it. Detoxing your body is very important, and that's the number one thing we hear with usually children is when they get adjusted, they actually go more. How many people do you think know that, or how many of your friends and family members have people that are struggling with this? Like I would say, digestive issues are huge in our community, and not all the people know about it. So I'm really excited about that functional change. Have you noticed any um, pain changes, or have you noticed any posh corrective changes in your spine? Like, do you notice your shoulders are more aligned in the mirror in the morning?
Yep. Standing taller, I feel better, feel more awake
Nice.
in the morning.
So if we reach those three benchmarks, you feel better, you're functioning way better. That's going to improve your health drastically, and you're noticing some structural correction. That's what I expected for you. Have a great day.
So what's the conversation? So tell me, like, what is the system during that first re-exam? You're actually re-X-raying at
Yeah,
12 visit mark, so the 1 month
yeah,
mark, right? What
yeah.
X-rays do you take?
I take them all,
Full set.
full
Okay.
set. We charge for our re-exam, we charge $350. So 100 for the exam, balance, posture, flexibility, palpation, orthopedics. We have to do those. And then we do the full set of x-rays.
Any other testing happen during that first re-exam?
Um, yes, use your clinical judgment. If they're saying I have something new, look at it. Don't brush it over. My elbow hurts. Check their freaking elbow, move it around, say it's coming from your neck. Meet, like I always do this, meet the patient where they're at. Hey, doc, I have this new pain in my ankle. Put their leg on your knee and feel their ankle. You know what I mean? Like, oh no, I'm a principal chiropractor. I don't do that. Please don't do that. Address their needs because if they're saying something is up, you can always relate to function. Hey, your pelvis is bouncing. Your ankle is actually moving more. It's starting to rehydrate. And I feel like that's why it's hurting more because you're actually using the joints and muscles, ligaments, tendons, and the subluxation of your spine that's freeing up is allowing you to feel that because it was numb before and it's not tingly. It's actually healing. Thank you, John, for bringing that up with me. Like address any questions they have.
Do you set up a report of findings after the re-exam to go through the X-rays with that patient?
Absolutely.
Doesn't
It's the
happen
next
the same
it's
day.
the next visit.
Right.
And I bring up the first set and second set. Do you remember is a very powerful statement. Do you remember what your spine looked like when you first came into our office? 90% of people are going to say what? No. So I have a firm belief that people will never remember what you did or what you said, but they'll really remember how you made them feel. This is crucial, is not this re-exam or sorry, re-report of a report of x-rays is not a scolding appointment. Hey, this is the correction we got 5 degrees. And I know we talked about, if you didn't do full your home care, but I fully believe we could have got about 10 when if we were doing that together. Is there any way that we can make that happen? Just please remember they're gonna know, you know what I mean? Because they're always scared to tell us stuff because they think we're gonna take it personal. So it's their spine, not yours. But I always translate to we want to hit those three benchmarks, and then we look at the X-rays. Lateral cervical always first, right? We talk about principle. God put this amazing healing power in your brain. It's functioning better because he went from 19. I'm going to talk about Katie's X-rays because I just went over these X-rays. Katie went from 19.1 to 24.3 in 1 month. And please wait. Let them say something. It's very important that you wait. They're going to say, wow, that's great. That's what I thought. I think 5 degrees in a month when this has been there for 17 years is a huge accomplishment. But I want to congratulate you on making all your appointments. This is where you got to know your patient. I want to congratulate you on making all your appointments, doing your home care, showing up here, never missing an appointment. You didn't even change one appointment. You're an amazing patient. Your low back is da 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 da. Compliment them. Shower them with love. Do you know what I mean? Like, it's not just looking at an x-ray, it's complimenting how hard they've worked. Because getting to your office 12 times is no easy feat in today's busy life. I can tell you that for sure. It's a very difficult thing for them to get there 12 times in 1 month.
So person's missed 6 of their first 12 adjustments. Do you still do the re-exam at the 1 month mark? And then what's the dialogue that you have with that person?
Absolutely. Still do it. That was your schedule. They missed 6 visits. They could have been on a 2-week vacation. Now, in the instance, it's the reason why they're missing. Um, because that patient's already quitting if they miss 6 visits, regardless for a vacation or they're busy. So the dialogue is, hey, we did the exam and x-rays. I noticed that you haven't been able to fully commit to being here on your visit schedule. I know that you're busy at work, but what I gotta ask you to try a little bit harder. Is that okay? And I'm not saying this is the end all be all, but this is your health. And when we look at your x-rays, I can see, Matt, your x-rays were at 20 degrees in your neck and only went to 21. And your low back is 30 and only went to 31 degrees. We got one degree out of 6 visits. Now, if we're going to approach it like this, we have to completely and radically change your care recommendation. And we do have to decrease our expectations long term of what this is going to do for you.
So that I'm so happy you answered that in that way, Kory, because I think that the key is to be confrontationally kind in the situation.
Mhm.
You can't let patients off the hook and expect that they're going to be good long-term lifetime wellness care patients. You have to raise the bar for them and hold them accountable.
I do also say my fear is that we're going to be in the same predicament when you first started in our office and you've been going to the chiropractor forever haphazardly and you have blown 2 discs, you end up on the floor. I just don't, I want to make sure that I'm trying my best to help you get here to the best of your ability.
Well, this has been awesome.
Hey, can I jump in with a question here? It's Kevin.
Please, Kevin.
Yeah. Yeah. Maybe a follow-up to Brian's question. When you get older patients to start doing therapies, we have this
Mhm.
quite a bit where they might do it for a while and then they'll say, okay, I'd like to drop it again. Or let's say a new patient that did it for 6 months and they say, I have the body weights at home. You know what? I'm going to purchase a ServaGuard so I can go home and do all my stuff, but can we take that off my plan now? you know, are you okay with that? Or everybody does therapies as the standard office visit? Like there's no option to opt out of that.
What I do now is they do 1 to 2 years of therapy. So after the 2 year mark, they're allowed to just get adjusted, warm up and get adjusted.
Mhm.
So they do the wobble tractions and then they get adjusted, but they have to wear a server guard. Right, so they can just sit on the chair and wear a server guard. They can bring their own in, wear it in your office for 20 minutes. They still have to do it right after getting adjusted.
Right.
That's the best time for the nervous system, the most adaptive. It's within that 5 minutes of after getting adjusted. And I know you live 20 minutes away, Kevin. There's no possible way you'll be able to throw that server guard on unless you're doing it in your car, which I would be
But
okay
but
with too.
these
But
people are trying to save cost, is what they're doing. They're like, can we take that off to save the cost?
yeah,
So
I sell the server guard for $575. Like they want to
yeah,
buy one. You know how many vibe therapies that is? That's like 3 years of paying $22. You know what I mean? So
yeah,
they can do that. Absolutely, you can save the cost, but unless you have a vibe at home and a server guard and you can get there under 5 minutes and put it on and get on it, it would be detrimental to your care in our office. Like I'll agree to do it, but when we go to re-X-ray you and your spine's worse, are you okay with seeing that? And if not, I would say no for the extra $19 you're paying. It's worth the world to you.
yeah.
Yeah,
Okay.
that's
Okay.
huge. And Kevin, that's such a great question. And this is where I would say, and this is to everybody, is that we all have patients who are on quote unquote wellness care. Don't take them for granted. In other words,
Mhm.
make sure that there are regular re-examinations set up for anybody who's on, whether it's weekly, bi-weekly, even monthly wellness care. And don't be afraid to call them out on the fact if their spine's getting worse, whether it's neurologically through a scan,
Mhm.
some sort of objective measurement, a posture measurement, or an x-ray. Don't be afraid to challenge them and say, okay, this has gotten worse compared to last year, the year before that. I think it's time for you now to start onto a more frequent care plan to re-correct these areas and keep them where they're supposed to be. Don't be afraid to do that. Because what happens is, and that's kind of the mentality, and I see this all the time in the profession, is that it's the initial intensive care and you get somebody on wellness care and you forget about them. And you think they're going to keep coming in the rest of their life at once a month because they've already been through your initial intensive care. Don't be
Mhm.
afraid to re-examine those patients, re-monitor them, and recommit them to a corrective care program. That's what you're there for. You're there to keep their
Mhm.
spine and nervous system corrected so that they can function fully and express their full God-given life potential. And
Mhm.
they can't do that if their spine's degenerating, even though they're coming in once a month or once every 2 weeks.
And I would give them an option too because they're important to the practice. I mean, every wellness patient can be a brand new patient for you. Um, I'd be okay with it. Say, yeah, we can do it that way. I'm open to that. But if it gets worse, are you open to doing a burst correction? What's a burst correction? That would mean when you come in for 6 weeks at 3 times a week to recorrect it, and then we'll go back to every 2 weeks. Because next year, that's what we're gonna have to do if we drop the vibe therapy. As long as you're okay with that, I am willing to drop the vibe therapy with you. But are you okay doing a burst next January? And just let them decide. Either keep the vibe therapy or do a burst correction. Now you have a person that's coming every 2 weeks, coming 18 times in 6 weeks.
I have a question, Kory, and I remember you teaching this before, but say somebody has a scoliosis, so like the old
Mhm.
Not Tony, now the same. So like low right shoulder, low right hip.
Mhm.
Are you still on the vibe plate doing like all anterior, all posterior first,
Mhm.
or would you add and then at the same time the hip weight, shoulder weight, or and if so, if you don't do it at the same time, when do you decide to add those weights?
This is a great question because I'm just going through this right now with a patient that's being adjusted by Dr. Suzanne for the last 5 years in this practice. And now he has like a 40-degree low back, just low back scoliosis, neck curve 53, low back curve 47, like looks awesome. And so he's going to do double or triple therapies. And so I put together a care plan with adjustment. He's going to do all anterior cervical guard because I'm going to brace his neck and I'm going to do still a low back 5 pounds to get his low back to get 45. And I'm doing a server guard. Think about this. His curve is 57. We're trying to reduce his curve so the plunger's out and we're just putting it into good position. He's doing 20 minutes of that. Then we do full head weight, chest weight, pelvic weight for another 20 minutes. Then we're doing the cross body for 20 minutes. He's going to be on the vibe for an hour in our office.
Not at the same time. You would not ever do like anterior, say an all anterior plus the cross body weighting. You would make sure that the
No,
body
it's
weighting
all
is done separately.
It's all separate. And
Okay.
so he's gonna be on the Viaplate for an hour, and I'm gonna charge for an hour of therapy. So it's gonna be not 25 a visit, it's gonna be 75 for the vibe therapy a visit. Just make sure you're charging for it. That takes a lot of time and energy and attention. It takes your team to watch them because if they're doing something wrong, it takes a lot. So you cannot, like, it's not just, yeah, I would charge for everything. That's going to be a very expensive care plan, but it's worth it. Okay. So just make sure you charge for it and explain why.
And then so somebody who has also rotation. So say they have that scoliosis. Now you've done all anterior. They've got the C curve back. They've got the lumbar curve, or they're doing like you said,
Mhm.
2 times the therapies. But now you add that rotation because that's where like the weighting rotation. I'm gonna say I'm poor at is
Mhm.
I can get I get to like that level for scoliosis, but when they have the spinous rotation into the concavity, is that now another set?
Another set of x-rays or another set
No,
of
another
body
set of,
weighting?
like putting the weight, like say on their pocket or on their, the
Yeah.
rotary weighting. I'm
Yeah.
good at the weighting when there's rotation. I kind of get
Mhm.
the first 2 levels that we,
Mhm.
all anterior, all posterior, or combo, and then
Mhm.
the body weighting. But when you add that rotation, now how does that work?
I do x-rays with all the body weights on. So this is where it's a little tricky. We do x-rays with them in the
To
like
see
the
what happens.
cross body. We just I want to see it because this guy Austin has a huge lumbar rotation and lateral flexion. So we're setting aside a specific time right now to do all those x-rays for him.
And then you decide, would you then combine the rotation of the pelvis as well as the crossbody, or would that be like a third step?
I would do all the cross body weighting and all the anteriors. I wouldn't address the rotation because you can derotate a pelvis by doing side posture,
Okay,
Thompson drop rotational adjustments on the lumbar spine.
thank you.
But it's just the rehab after that's so crucial. You just got to explain they're going to be in an hour for an office doing rehab.
Okay,
At least.
and I think I'm trying to figure out the time to do all anterior or all posterior or whatever the combo is, plus the crossbody, and figure
Mhm.
that timing. And then I haven't been charging them twice, to be honest. So I appreciate it.
Mhm.
Thanks for
Yeah, it creates because then the value's there, Justine, because you're an expert and you're pro at it, and so like it's just you're on it for 3 times as long. It takes so much attention, so we have to charge accordingly. Like you can give them a discount, but make sure it's very clear on a care plan. Vibe therapy with CerviGuard body weight, vibe therapy with body weights, then vibe therapy cross body. Like it's an hour of vibe therapy.
Okay. And then just um as you're doing that and they go into wellness, you're saying you're doing that for 2 years?
I always explain that it takes 1 to 2 years to fully correct a spine. We're starting at 6 months. That's where I'm comfortable giving you a 6 month recommendation. See where we land after that. I expect 80% of the correction to happen in the 6 months. After that, we are going to slowly chip away at getting the spine more fluid. So functional, bending, twisting, moving. Now you have scoliosis. This could take up to 3 years. Our job is not to fully fix this. It is currently to manage what is happening in your spine. We cannot let it get any worse because the next step is surgery. So what we have to do is manage this and reduce it as much as possible. So I'm not even looking to correct it. I'm just managing and reducing. And that'll feed into your wellness saying, because you have this gnarly curvature of your spine and subluxation is definitely present, your wellness is once a week and you have to be here for the hour doing all the vibe therapy, bodyweight bracing. Or
Thank
buy a vibe plate at home, make sure they're doing it at home, but they're more compliant in your office.
you. Right. I agreed. And then I don't mean to monopolize, but we do have a few people who get a lot of vertigo, dizziness on the Vibe. So I've been using the balance plates, like the balance
Mhm.
pads,
Mhm.
with the weighting. Is there another way to manage those that get like that severe vertigo, feel like they're going to throw up on the Vibe?
I would take away the balance pad first. I would take away the balance pad first. And then if there's still nauseous vertigo, I'd body weight them and have them stand on the vibe plate, put it on for 5 minutes, turn it off, let them stand on the vibe plate in good posture on a balance pad for the remainder of the 15. That doesn't work.
We're doing, yeah, slowly trying to take away the
Yeah.
balance pad.
But
Some of them can't even do a minute. Like
even if even if they stand on the balance pad with no vibration plate on, do that for 15 minutes. They cannot hang out to the handles. They have to balance. But I would buy a Bosu ball and have them be on a Bosu ball, something a little bit that's really firm. Like I would do something because they have all the stuff in Tony's office to negate that. But yeah, that's what I would do. I'd have them stand on the biplate and do like a minute on the balance pad, and then I'd turn it off and have them stand for the remainder of the 15 or 20.
So I've been putting the balance pad on the ground. You would put the balance pad on the vibe plate to reduce the amount of vibes. So that, like, they're literally standing on the first, because they're so dizzy with vertigo, standing just with the body weight on the ground, and I just try and have them march in the spot. Then go to the balance pad. Your next step would be balance pad on the vibe plate and then the vibe plate, like in that order.
I just keep them on the vibe plate because I'm charging them for rehab. That vibe plate is theirs whether it's on or off. So
Wow.
the balance pads stay on the vibe plate. They're just in that area. I would just have them stand on the balance pad, hold on to the handles. We're going to put on for a minute, turn it off, and then you're going to stand here for the remainder of the 14 minutes and make 15 minutes of rehab.
Okay, thank you.
So let me address this to the rest of the group, and I want to make sure that we all understand this. Is that this interaction between Justine and Kory, this is high level thinking. Don't let it confuse what you're doing, right? The most important thing to take out of this is the communication to the patient about them sticking with their care, doing the therapy that you've suggested, even if it's something as simple as just sleep rules. Like let's make this simple, okay? So don't confuse this, because I know some of you on this line or they're watching this recording are going to go, wow, this is way beyond where I'm at. And yes, it is. So keep it simple and just take out of this the ability to communicate to the patient and hold them accountable and get them committed to at least doing what you're delivering in your office.
Yeah, do all the adjustments the same, do everything the same, and add a home care kit. That's what Tony always promotes. Add a home care kit, get them doing home care, charge $475 for it. That is our price. Do not charge a penny less than that. So charge $475 because you're going to make $225 or $270 on that. We actually charge for our prescription sheet $75 because I got to sit down and do it. That's not, so when you look at it, they're paying us $550 for a home care kit and a prescription sheet. And the reason it's so much is because you got to learn so stinking much to look at an x-ray market and analyze it and give good, proper rehab. What I've really noticed is when our team, when our Winnipeg clinic, when the doctor who came in there, he'd been practicing for 30 years. He had no understanding of how to give Mark an x-ray or how to give rehab. So think about that. A guy that's been practicing for 30 years, and I'm not talking poorly about him, but what you do learning that has so much value for the patient. So charge them accordingly.
Right. Right. And you just nailed it, Kory. And the fact is, you have to get yourself better and own what you're delivering first. And when you're confident, then you can charge whatever the heck you want for it. But you have to get confident and learn the stuff first.
One more thing I wanted to mention. So we do a use server guard program in our office. I don't know if I mentioned this before. We use our server guards. We start them with a color. We use them for 6 months. We strip all the padding off them. And then what we do is we put new padding because they all come with new padding in a box, and we sell them for our cost. So we sell them for the $325 that it cost us. These ServiGuards you buy for your office are going to cost you nothing because the patients in your office are going to participate in the used ServiGuard program. They're going to save $200 and we recycle them and buy brand new ones. Every 6 months, we buy brand new ServiGuards. They're never old and used. They're never decrepit. We sell our used product that we use in our office, body weights included, to our clinic members, our practice members, or your patients at your cost.
Awesome. Awesome.
I want to thank you so much, Kory. Like lots and lots of nuggets here, and I want to thank you. I want to rewatch this one. But I just so everybody knows, the traction unit now is on Amazon at half price, approximately. Like it's like $40, but it's shit. So your patients could bring it up to you. It's not put together and it's not as strong, and it doesn't have the latch. So if I've had a few like literally bring up the wobble cushion. Here, this is why I can get this on Amazon. I can get the traction unit on Amazon. So just if it does come up to you, we purposely purchased the Amazon one so I could compare it and have it in the office. So I can say, look, yeah, you can get this in Amazon. Look at the quality of this one. It's crap. Look at the quality of this one. Does your spine deserve garbage or does it deserve the best?
Can I make a comment on that? Charge them more for your prescription. If you buy it on Amazon, your prescription sheet is $225.
Mm-hmm.
I would honestly just charge for the prescription sheet. What kind of exercise are they going to be doing with it? They can buy it. Absolutely, you can buy that. Your prescription sheet, when we have an Amazon product, I can't promise you're going to get the results because the quality of that isn't great. And so what we do is your prescription sheet, typically when you buy our home care kit, is $75. If you're going to buy it on Amazon, we do charge accordingly to that. So your prescription sheet would be $275 to learn how to use that equipment because it takes me time to I had to buy one and figure it out.
Hey, great call. I ditto what Justine's saying. Thanks, Kory. For the vibration plates, say a home plate that some people have, it's obviously totally different. It vibes on both sides separately. What explanation though for somebody who gets that, who's been through your care, who wants to do the ServiGuard at home with that vibe plate?
Hey, Phil, that's a great question. The only problem is you have to be on that vibe plate within 5 minutes of getting adjusted. So what I'd really encourage you to do is keep that in your care plan because I know where you live and you're 25 minutes away. And so to neurologically impact your spine the best, it's the best to be on the vibe plate within 5 minutes of being adjusted. And so we're going to keep that in your care plan. But by all means, ServiGuards are $550. I want you to buy one and use it at home. It's great. You can always use it at home. We believe in doing home care and rehab. So don't get away to the vibe plate. Still use that at home as an addition to your health investment.
Okay, and that's a great answer. The other question was the ServiGuard is promoted if you go on their website to just use 20 minutes a day at home. How do you, if they go on that and find that, what's your explanation with that?
Yeah, use the ServiGuard 20 minutes a day. Yes, absolutely.
Okay.
Yeah, like that's if they buy one, they're going to use it every day.
Right.
And I would push the people that are once a month. Those people want to go once a month. You can absolutely do this. You have to use your ServiGuard. Have to every day. Like not like it's an option. Like you have, and I repeat it, like you have to use that. If you're going to be dropping to once a month, you have to use this once a day for 20 minutes. Relaxing, leaning back on the couch, not watching TV, not cleaning dishes or taking care of babies. You have to just have 20 full minutes yourself and every day. If you don't, and we go from every 2 weeks to once a month, you're going to see a drastic change in your spine.
Okay, well, I want to just say, Kory, thank you and to respect your time. We're going to end it here. So, guys, I appreciate you being on the line. And Kory, I can't say how much we appreciate you being with us. This has been incredibly valuable. And certainly, if you're more than willing to do this, we'd love to have you back, as often as you'd be willing to do this, because I can see how people are just lapping this stuff up. So important stuff.